Moving on, the drug antipsychotic. Antipsychotic drug is now we are going to revision after discussing this topic. So antipsychotic drug are also known as neuroleptic drug or the anti-schizophrenic drugs, or this drug or neuroleptic drug are mainly used in the schizophrenia or acute mania and acute psychotic state. Using the others acute psychotic states. Now we are moving on the difference between the psychosis and the neurose. So psychosis is a major mental problem. It is a major mental problem, and when as compared to the psychosis, there is neurosis. So it is a minor mental problem, minor mental illness. And when we inside into the illness is lost, but in the neurosis, insight is the present, but here the insight is the lost. And there is judgment is lost. Judgment criteria, or the capacity to discriminate between the right and wrong, good or bad, is lost. But in the neurosis there is no loss of the judgment, or no loss of the discriminate between the right and wrong, good, bad things are not lost. And when we look at the psychosis, so in psychosis there is a disturbance of the mental function, there is no thinking process, no emotional etc. But neurosis, there is a rare case we found this type of the cases. And when we look at the psychosis in the disturbance of the thought, there is a disturbance of the thought present, example in the schizophrenia. But when we look at the neurosis, there is a disturbance of the thought, rare found. There is a anxiety neurosis, or the phobic state, abnormal fear, obsessive obsessive compulsion disorder, and hysterical attack, reactive depression. This type of disease fall in the neurosis. So when we look at the example of the anxiety, in the anxiety there is no this type of symptoms, disturbance of the thought, mental function, or thinking, emotion. This type of unstability not seen. So neurosis is acute, or neurosis is the minor mental illness, but the psychosis is the major mental illness. So major function of the brain is affected in the psychosis. Moving on the classification of the drugs, there is it is classified as the phenothiazines, thiogenthins, butyrofens, and atypical antipsychotic drugs, and other group. So in this phenothiazines, these are the drugs chlorpromazine, trifluoperazine, and thioridazine, and flufenazine. These type of drug these are classified as in between the phenothiazine, chlorpromazine, trifluoromazine, and trifluoropromazine, and this thyroidazine, and flufenazine. We also discussed this type of drugs, mechanism of action and other things. So in the thiogenthins there is only one drug, flupentazole is in this set. And when we look at the butyrofenone, in butyrofenone there is haloperidol, trifluoperidol. And atypical antipsychotic drug, there is the risperidone, clozapine, then olanzapine. There is zotapine, and this type of gepardinson, amisulpride, and there is a epiprazole. This type of drug are in the atypical class of atypical antipsychotic. And in the other, there is a loxazepine and pimozide. So when we look at the mechanism of action of the antipsychotic drug, it's when we look at the conventional antipsychotic drug, there is a mainly block the dopamine D2 receptor, and D2 receptor in the limbic system, and also the mesocortical area. So in the further we discussed regarding this type of receptor. So moving on the like another mechanism of action, there is atypical antipsychotic. It's block the serotonin receptor and in the mesolimbic and mesolimbic system, 5-HT2 receptor in the mesolimbic system. And now move on the drug like chlorpromazine, or in the class of the phenothiazine. So when look the chlorpromazine is a prototype drug. And when look the pharmacological action of the chlorpromazine, so we can move on the like there is a table here, 5.15. In this table there is like in this table we can, there is the action of these drugs. So I'm going to discuss it from this. So it is like in the central nervous system, in the patient with the schizophrenia, chlorpromazine it reduce the agitation and aggressiveness, and also reduce the spontaneous movement, suppress the hallucination and the delusion, and also relieve the anxiety. Like it act on the like dopamine receptor too, and that lead to like help with the limbic system, or there is a basal ganglia, and basal ganglia there is the like there is in basal ganglia there is like initiation and reduce the effect of dopamine, and that help to the like initiation and suppression of these effects. So reduce the spontaneous movement, there is a suppression of hallucination, delusion, and there is a relief anxiety. So it's correct to disturbance thought and behaviors also, and it does not affect intelligence but impair the vigilance. It does not affect the intelligence but it impair the vigilance. And when look the each act on the central nervous system, CNS, this type of action seen. But when we look the CN endocrine, there is like prolactin secretion is under the control of prolactin releasing factor. So and the prolactin inhibitor factor, prolactin releasing factor and prolactin, when hypothalamus, from the hypothalamus to the pituitary, anterior pituitary, there is a like this releasing prolactin releasing factor and the prolactin inhibiting factor controlling the conducting the prolactin level in the blood or in the circulation. So when prolactin inhibitor factor itself is a dopamine, when it suppresses the dopamine or receptor, so it's blockade of the like dopamine receptor, so in the pituitary may increase the formation of the prolactin and leading to galactorrhea, amenorrhea, and infertility in the female, but gynecomastia in the male. This inhibitory factor is a dopamine, and dopamine come into the pituitary gland, and pituitary gland there is a receptor in the anterior pituitary, in the cell of the which is release the prolactin. So there is a receptor for dopamine receptor, and this dopamine receptor blocked by this drug, and when there is blocked, there is a release of inhibitory factor is inhibited, so there is a release of prolactin, and that this prolactin lead to this type of the symptoms like galactorrhea, amenorrhea, and infertility in the female, but gynecomastia in the male. And other actions, we can look at the table. So I'm not going to discuss regarding this other action. There is a systemic actions. So now tolerance and sedative hypotensive action developed within the few weeks. There is a like it's tolerance to the sedative and the hypotension action developed within the few weeks. And when we look at pharmacokinetics, so phenothiazines are the effective orally and parenterally. Uh, chlorpromazine is a highly bound plasma protein. Highly bound plasma reaches to the high concentration in the brain. It is metabolized in the liver, exit through the urine. So when we look at this like pharmacokinetics, it is like especially in the orally and the parenterally. And like this chlorpromazine is like highly bound plasma protein. So it is highly bound plasma protein, the high concentration of the high concentrations go in the brain, and that like it metabolized and it is metabolized in the liver and exit through the urine. So now moving on the like how chlorpromazine blocks. So moving on this, like chlorpromazine, it's act on the dopamine receptor, and dopamine is present in the limbic system and mesocortical area. So the main effect is seen in the like antipsychotic effect, and there is a CTZ area also in basal ganglia and the pituitary gland. So when it's blocked this receptor, when blockage this receptor, like there is, if the blockage in the limbic system and mesocortical areas, then there is antipsychotic effect is seen. But when it's blocked the like CTZ area, so antiemetic effect seen. Antiemetics, like there is no vomiting occur. So it helps in the prevent the vomiting center. So when dopamine block the basal ganglia, so there is a like extrapyramidal symptoms seen. Extrapyramidal symptoms are seen, and like Parkinson's like type of symptoms. And if is dopamine block on the pituitary, there is an increase of the prolactin release, and that prolactin release in the female lead to like infertility, galactoria, and like this type of symptoms in the male like gynecomastia. And when we look the and the this chlorpromazine blocks also serotonin receptor, and it also like also act as like antipsychotic effect, but when it block the alpha 1 adrenergic receptor and in the heart, so it lead to the postural hypotension, tachycardia, palpitation. But it block when it block the H1 receptor, uh, and this when H1 receptor is blocked, then there is a sedation, antipyretic effect, puritic effect are seen. But when its effect on the muscarinic receptor, like atropine is a block the muscarinic receptor, so that type of action seen, like there is a dryness of the mouse, acetylcholine is not released, acetylcholine is not acting on the like muscarinic receptor, so there is a dryness of the mouse in the salivary gland. If the act on the salivary gland, it blood vision in the eye, and constipation, urinary retention are seen. Now, phenogantins decrease the seizure threshold and may precipitate convulsions, and so these are the like regarding on the this is the regarding mechanism of action, how this chlorpromazine blocks or phenothiazine blocks the and so that this type of action. So moving on the adverse effect of antipsychotic effect of adverse effect of antipsychotics. So when you look the side effects, so there is a lot of side effects, like drug are dose dependent. This side effect based on a drug dose dependent. Extrapyramidal symptoms are seen, like Parkinsonian dopamine decrease in the Parkinson. In the Parkinson, there is a tremor, rigidity, hypokinesia, and centrally acting anticholinergic like benzohol, bentrozip, bentrop, benztropine, antihistaminic like promethazine, diphenhydramine, etc. like are effective in control these symptoms. When we giving the this type of drug, so we can also give this drug to the control if there is a Parkinson type of the disease or Parkinson type of symptom is seen. And there is a acute dystonia. Acute dystonia sudden onset of muscle spasm and resulting uncontrolled muscular movement involving like face, tongue, neck, and its respond to the centrally acting anticholinergic, and for example like benzoxazole. It acting as a like anticholinergic, example benzoxazole. So there is a blockage of the anticholinergic receptor, and that lead to like this type of muscle muscle spasm, or the involuntary movement of the muscle. Now moving on the akathisia. In the like akathisia, there is a feeling of restless, and a person cannot sit at the place and has the desire to move about. It is referred to the like benzodiazepine, clonazepam, and like a beta blocker like propranolol, or centrally acting drugs we can give like to prevent this akathisia. Like feeling restlessness, if patient is feeling restlessness, this patient has suffering, like there is like a patient cannot sit a place, and like he has desire to the move, or like work something, do something. So this type of patient, since then we can treat with the clonazepam suppression, or the like beta blocker propanol, or the centrally acting